Hello, in this video, we're going to look at Neisseria Gonorrhoeae A to Z completely, and we're going to understand what causes, Neisseria Gonorrhoeae infections, how it spread, what are the signs and symptoms of gonorrhea, and what are the treatment options we have for patients diagnosed with gonorrhea infections. At the outset, please understand, gonorrhea as an infection is a sexually transmitted infection. It's an STI, and it's caused by an organism called as Neisseria gonorrhoeae, and it belongs to a group of what's called as gonococcal infections in men. Now, whatever I'm telling in this video is backed by what is published in the Center for Disease Control and the WHO websites. You can go and check it out there. Now, with respect to Neisseria gonorrhoeae, it commonly spreads among three groups. One, men who have sex with men, NSM groups. Number two, men who have sex with multiple women. And number three, women who have multiple male sexual partners. And what's interesting here to note that is majority of the cases are asymptomatic. So most patients will harbor the gonococcal infection of Neisseria gonorrhoeae and then they may not have any presenting clinical symptoms besides. So the infection is predominantly silent. With gonorrhea, another interesting observation that we commonly note in patients is there is a co-infection risk with chlamydia. What that means is STD co-infection. What it technically means is if a patient contracts or if a patient gets gonorrhea from another partner who he or she has had sexual intercourse with, there's a high risk of chlamydia also coming in. There's a high risk of HIV being acquired. There's a high risk of herpes being acquired. There's a high risk of syphilis and hepatitis B also being acquired. That means STDs generally infect together. So one STD infects a patient, there's a high risk of co-infection with other STDs. When a patient is tested gonorrhea positive, testing should not be done in isolation. The testing should also involve other common sexually transmitted infection, especially chlamydia and as well as HIV. What are the common symptoms? So we initially stated that symptoms are very rarely seen in patients with gonorrhea, but if patients do develop symptoms, it's usually burning sensation while passing urine, pus discharge from the penile urethra, that is from the urinary tip, and also sometimes the patient can have mild itch. The tip of the penis will be itchy. It's called pleuritis. And frequently when testing will reveal either gonorrhea or chlamydia or sometimes even both. Patients can also have harbored both the infections. We have looked at how gonorrhea spreads, among which groups it spreads, what are the signs and symptoms, and how do you prevent gonorrhea? So the prevention is, as you commonly know, is you have to use protection always. So condom is probably one of the best methods of prevention. Mind you, condom does not, if you remove the condom and have orogenital sex, like you have intimacy, with the woman, she gives you orogenital stimulation. There again, gonorrhea can still spread. So even a condom should be worn during penetrative penovaginal sex as well as orogenital sex. And generally, always, please avoid anal intercourse, whether it's a male or a female. Please avoid that. Very high risk for gonorrhea, chlamydia as well as HIV to spread. So in fact, it's probably, we don't have the exact metrics, but we commonly see patients who have anal intercourse come positive with gonorrhea, chlamydia or HIV or syphilis or hepatitis B or some STD or the other. So those are the ways in which you can prevent gonorrhea. And how do you treat gonorrhea? So once a patient has been diagnosed with gonorrhea, common treatment options would include giving an injection of ceftriaxone. Ceftriaxone is a cephalosporin antibiotic. We usually give 250 mg. For some patients, we give 1 gram. It really depends on the patient's individual symptoms and signs in the presence of other STDs. Azithromycin 1 gram single dose can also be given. It's better to give azithromycin as well as doxycycline. Doxycycline dose is about 100 mg given BD, that is morning and evening after food, for a period of 14 days. I strongly recommend visiting a proper andrologist or sexologist or a sexual expert before taking these medicines blindly or before self-administering your self-treatments, because what's key is if you have had an unprotected sexual intercourse or encounter, key is testing. You cannot compromise on testing. You have to get tested, you have to get tested, and only then a treatment has to be started. More so if you have loved ones in the family. So I hope you found this video informative. I hope this video gave you a small, a consolidated set of facts about gonorrhea. And the next, I'll see you back with other videos, and we'll have more topics on STDs going forward. Please put in your comments below. Please put in your queries below. Please like the channel and subscribe. Please support our channel so that we can make many more such videos. Thank you. This is Dr. Shah signing off.